Hello and welcome. My name is Dr. K.C Nudelman. I am a medical doctor at Princess Marina Hospital in Gaborone, Botswana. Today's presentation is titled Diabetes and Macrovascular Disease, and it is submitted in full for Module 6 Individual Activity for PG Dip in Diabetes, University of South Wales. What is macrovascular disease? Macrovascular disease includes coronary artery disease, peripheral artery disease, and stroke. The main pathological mechanism responsible for causing macro disease is the process of atherosclerosis, which is thought to result from chronic inflammation and injury to the arterial wall of either the coronary arteries or peripheral vascular system, which in turn leads to an atheroma formation. Diabetes has also been shown to increase platelet adhesion, hypercoagulability, as well as impairment of fibrinolysis. This is a diagram that shows the pathological pathway to an atheroma formation. So as you can see, this is a normal healthy artery, and this is the lumen, what it looks like. It's free, it's smooth, blood flows smoothly through this. So injury and inflammation will be the initial insult, and this will lead to oxidized lipids to infiltrate, forming this cholesterol plaque. This in turn causes your responder cells to try fight and control the injury. So they also come in, the smooth muscles proliferate, the collagen accumulates, and the net result of this process is formation of this lipid-rich atherosclerotic lesion with a fibrous cap, so it's sealed off. As you can see, compare this lumen to this lumen. The lumen here is narrowed compared to in a healthy artery. So the atheroma rupture, that's what leads to an acute infarction. If the fibrous cap happens to rupture, what happens is your responder cells come to try and seal off the leak. And to do that, it forms a blood clot, which we refer to as a thrombus. But since the lumen is already narrowed, bringing in the clot to try seal off the leak leads to complete occlusion of the lumen. So as you can see, this lumen is completely occluded, meaning blood doesn't flow through. The distal areas, therefore, are starved of blood supply, and that's how you get your infarction. How does diabetes cause macrovascular disease, and what are my chances as a diabetic? Hyperglycemia and insulin resistance, they contribute to atherosclerotic changes. They do this by increasing oxidative stress and activating pathways that act on the endothelium and feed on the process from the previous slide. So chances, what are your risks as a diabetic? So for coronary heart disease, it depends on whether you've had an MI before or you don't have an MI. For those with no prior MI, diabetics have a 20.2% chance of developing coronary heart disease compared to just 3.5% for non-diabetics. For those with a prior MI, this value increases to an astounding 45% in diabetics compared to 18.8% in non-diabetics. So for stroke, diabetics have a 35% increased risk of developing stroke compared to non-diabetics. And for peripheral artery disease, diabetics have a twofold higher rate of peripheral artery disease and a 2.5-fold risk of intermittent claudication. How then can I reduce my risks? So risk reduction I have divided into lifestyle modification, decreasing your hyperglycemia, and treating your cardiovascular risk factors. So lifestyle modification includes reducing your BMI, regular exercise. For smokers, smoking cessation becomes important, and diet and nutrition to achieve and maintain goals for your plasma glucose. Decreasing hyperglycemia by reaching your target HbA1c. Remember, this is individualized. Your doctor will define your target for you. Treating cardiovascular risk factors. Those who are hypertensives, we start them on antihypertensives. Treating dyslipidemia. Most of you here, if not all of you, are probably on low dose aspirin, the 100 milligram cardiac aspirin, which is given for anticoagulation. Remember, we are trying to reduce all the things that we think contribute to atherosclerosis, which have been shown to contribute to atherosclerosis. I thank you for listening to this lecture. These are my references. Thank you again, and I welcome any questions or comments.